for your country, you can specify this information by searching or by analyzing of any statistical information of your statistical organization, medical statistics organization, for each year, in each year annual report. Else one, indicator of health disorders, so-called disability adjusted life years, or the sum of years of life lost from premature mortality or due to living with a disability. Examination of disability, it was a separate lecture topic in previous semester for your course. But now we are discussing rehabilitation of disabled patients. Big part of disability causes takes chronic non-infectious diseases such as cardiovascular, oncological, respiratory, and others, endocrinology diseases, and others. Relevance of today's topic associated with most important task, primary healthcare doctor or provider, primary healthcare, to prevent the development of disability, contribute to the restoration of disturbed functions, and reduces the severity of life limitation. These tasks are very important in each doctor practice, and of course in practice of primary healthcare provider. I'll remind for you, as I promised, definition of rehabilitation as process aimed at the prevention of disability and to achieve disabled patient maximum medical and social adaptation within existing disease. So our task, by correct organization and realization of complex rehabilitation program, prevent patient's disability and minimize his life limitations by activation adaptation processes, medical and social adaptation, despite on existing disease. As for patients with chronic non-infectious diseases, such as cardiovascular diseases, oncological, and endocrinological, main objectives of their rehabilitations are next: a restoration of disturbed functions. For patients with cardiovascular disease, with coronary atherosclerosis, with heart failure, we have to restore their or improve their circulatory function or circulation. For patients with respiratory problems, for example, after COVID-19, due to associated with non-infectious disease such as bronchial asthma, we should organize and realize program for restoration of respiratory function. For patients with locomotor system disorders, of course, locomotor function. And integral task, which we should try to achieve in the finally, improving the patient's life quality, the quality of patient's life as separate integral parameter, quality of life, which combines separate components such as physical functioning, social functioning, psychological functioning, general health, and others. Very important role in realization of a rehabilitative program plays a multidisciplinary team. This team ensures balanced decision-making and patient management in a multidisciplinary manner. What does it mean? This team sets goals of rehabilitation, develops an individual program of rehabilitation for concrete purpose, carries out current medical supervision and the complex rehabilitation measures, determines the need, duration, sequence and effectiveness of the participation of each specialist at each specific point in the rehabilitational process. What's the role of GP in this process of rehabilitation of chronically ill patients, or patients with chronic non-infectious diseases? You have to monitor the implementation of patients in outpatient settings, expert advice obtained at the hospital stage of rehabilitation. Timely referral of patients to the examination counter disability, inpatient and sanatorium stage of rehabilitation. Especially for patients after MI or after stroke, as examples of most serious socially significant problems associated with cardiovascular diseases. Other role of GP in this process includes the integration and coordination of medical specialists, neurologists, cardiologists, pulmonologists, between them, social workers, clinical psychologists, relatives of patients, in the direction of the best results, the achievement of best results of rehabilitation. What does it mean, best results? Prolongation of the disease remission, reducing the frequency of patients' hospitalizations, maybe most important, maintenance of their independence, physical and social independence. Also, I'll remind you of a few main basic principles of rehabilitation. There are continuity, it's prolongative process, sequence, step by step. We should increase, we should involve new components of rehabilitation to individual program. Each process we can divide on some stages in the rehabilitation process for better organization and realization. Which stages and views of rehabilitation intervention? Short-term episodic rehabilitation we can realize in so-called hospital or rehabilitation treatment therapeutical department of any hospitals or rehabilitation centers. Periodic rehabilitations. We can organize this form of rehabilitation, for example, each 3 months in health centers, in dispensaries, in rehabilitation centers. Long-term rehabilitation, more often procedures, more often interventions. We can suggest for our patients in clinics with day hospitals. And else more constant rehabilitation, almost without any breaks, at home. Home rehabilitation, which includes, which we can organize under the supervision of medical outpatient clinic or polyclinics, and also in the rehabilitation centers. And at home, of course. There's one parameter which I want to remind for you. It's rehabilitational potential. It's basic indicator which we should estimate before the onset of rehabilitation process. This parameter means a complex biological and psychophysiological characteristic of the person. His or her social and environmental factors that allow a greater or lesser degree to realize the potential of patient's organism to adaptation, to restoration, to replacement, or to compensation of functional failure. Here you can see criteria for assessing the effectiveness of rehabilitation. Of course, each process we should assess the effectiveness of our forces for possible corrections. We should take, before assessment of effectiveness, we should take into account not only medical components, but also social and economical aspects of effectiveness. There are which criteria? The number, amount of new cases, and the duration of each cases of disease, chronic disease exacerbation after completing rehabilitation course. For example, how many new cases we can calculate, how many 1 year, how many new exacerbation cases for patients with peptic ulcer, for patients with bronchial asthma after completing of rehabilitation course in a rehabilitation center or in sanatorium. And dynamics of temporary disability or temporary work inability. If this level, we'll define reducing the level of temporary disability, we can speak about effective previous rehabilitative program. Dynamics of functional disorders, functional insufficiency of any system, such as heart failure, failure and others. And of course, we should estimate development of disability. If we can prevent disability development, it will be maybe more significant criteria of rehabilitation effectiveness. And of course, we can prolongate patient's life and prevent premature death. Let's characterize private programs for rehabilitation of patients with cardiovascular diseases. Which objectives or goals of this rehabilitation? We will try to achieve, first of all, recovery of circulatory problems or circulation disorders, circulatory disorders, by activating the patient's compensation mechanisms. We will try also to improve patients' exercise tolerance. And we will organize secondary prevention of arterial hypertension, coronary artery disease, for improvement of patients' life expectancy and, as I said, for maintenance of his life quality. Other objectives for this patient's rehabilitation are return to professional work, if possible, for example, after MI or after stroke. The possibility of partial or complete failure of the medical treatment. And improvement patient's life quality. As for main tasks of cardiovascular rehabilitation, which we can decide, educating patients on issues related to cardiovascular diseases, informing them about the main changes in lifestyle and modification of cardiovascular disease risk factors, which have a beneficial effect on the stream of disease and long-term survival. Which is factors: hypercholesterolemia, for example, low physical or sedentary lifestyle or low physical activity, psychoemotional stress, and others. It was organized even a program, school for patients with acute coronary syndrome or MI, and his relatives. Educational. So educational component plays very important role in rehabilitation for elevation of its effectiveness. Other tasks of cardiovascular rehabilitation are participation of patients in various physical rehabilitation and long-term physical training, including sometimes uncontrolled training. I think you know that each rehabilitative program should include several components, several kinds of rehabilitation, such as medical, social, psychological, and for some categories of patients, occupation. According to this to plan of psychological rehabilitation, we have to achieve patient's psychological adaptation to his chronic disease, to his hypertension, to his ischemic heart disease, and their complications such as stroke or MI. Also, we will try to achieve increase in the patient's motivation to participate in cardiac rehabilitation programs. So we'll try to motivate them to be more active in participation of rehabilitative program, including specialist care, such as psychologists and psychotherapists. As for rehabilitation program components or requirements for patients with cardiovascular diseases, we should compose them strictly individually, depending on patient's age. Then older our patient with cardiovascular disease, then more delicate methods and regimes of rehabilitation we should suggest. Also, we should take into account character and stage of disease severity. We should analyze accompanied pathology of various organs and systems. And also, we should assess, estimate patient's individual tolerance to the various rehabilitation methods. For example, in this picture, you can see typical procedure for patients with any coronary heart disease problems, coronary arteries problems, physical tolerance test by velar ergometer, cycling test with control of ACG, with constant control of ACG by electrodes, and blood pressure and pulse rate too. So we should estimate initial level of patient's physical abilities for applying concrete rehabilitative methods. Now, I'll enumerate general recommendations for the composing of rehabilitation programs for our patients with cardiovascular diseases. Realization of any program should include preliminary and continuous dynamic control of doctor or rehabilitation specialists of the main indicators of cardiovascular system. At least heart or pulse rate and blood pressure. And, as I said a few minutes ago, evaluation of exercise tolerance. We should recommend mode-dosed physical exertion or regime of dosed physical exertion. Correction of patient's diet limitation of animal fats, glucose level, sugar level, salt intake, and other. Caloric restriction and other. Other general recommendation can include physiotherapeutical methodics for achievement of main targets of rehabilitation. Rational individual and or group psychotherapy, psychotherapeutical sessions for correction of very significant and very important serious risk factor of cardiovascular diseases, psycho-emotional stress. Also, it's recommended to involve family members, relatives of patient to realization the necessary assistance and monitoring of the rehabilitation recommendation for our patients. Main forms of rehabilitation for patients with cardiovascular disease, which doctor can prescribe and control. Prolonged physical exercise, most available and relatively high effective form. It's the best form of physical rehabilitation for patients with coronary artery disease. Regular physical exercises can limitate, in conditions of limited coronary reserve, can improve heart function, can provide stabilization, synchronization of muscle activity and cardiovascular and respiratory system work. Few recommendations for psychological rehabilitation after MI. It should be rehabilitation programs comprising psychological therapy or psychotherapy, except it counseling, psychological counseling, relaxation training, and training for stress management. Because it plays also a very important role for achievement the effectiveness of psychological rehabilitation. Physiotherapy methods are, which we can apply in cardiovascular rehabilitation. Morning hygienic gymnastics, morning exercises, training on simulators or kinesiotherapy, dosed walking, health path, hydrotherapy, and some kind of sports swimming and skiing. These exercises can stimulate a long-term synthesis of proteins, activation of any organism resources, for improvement of general resistance to any disease progression. For patients after stroke, we can recommend recovery of motor function, especially for patients after some period of immobilization. We have to prepare their organism for standing. Sensory neural stabilization is required on an electrically driven verticalizer that adapts the cardiovascular system to vertical efforts, to vertical lugs. As for kinesiotherapy in post-stroke rehabilitation, this technology used in the early recovery period after stroke in small group or even individually. Recommended for patients with paresis. A set of exercises is used to reduce muscle spasticity and rigidity. Also, it can help to prevent contractures and reduce the degree of paresis. For patients with atactic disorders, we can recommend exercises to increase their consistency, improve coordination of movement, and train balance, which can train balance. Also, we should to restore the power function balance. And for this aim, we can use a balance training, which you can see on these pictures, balance training. Or form mattress. As for physiotherapeutical methods, which we can recommend in post-stroke rehabilitation, we can start to prescribe this method 2-3 weeks later after stroke, including laser, infrared laser, magnetotherapy fields, procedure of electric stimulation of paretic muscles, and using if is recommended pulse currents. For psychological care after stroke, of course, we can suggest psychotherapy. We should recommend to talk with qualified psychotherapists who can help with a variety of mental health and cognitive conditions, including post-stroke depression. Then earlier we will start this treatment and rehabilitation, then more early effect we can achieve. Except for psychotherapy, we can recommend positive psychology, with focusing on mental well-being, for creating an happiness atmosphere and meaning, fulfillment through exercises that help retrain the brain. As for mindfulness, this method includes the practice of living in the present moment, rather than worrying about the past or future. We can apply apps that help with mindfulness. Cognitive behavior therapy, for example. This is modality of psychotherapy which is based on the idea that our emotions are caused by our thoughts. And by challenging negative self-talk, it can help improve patient's psychological well-being. Of course, it's not so simple. It requires some forces and high qualification of psychological worker. But now we haven't other way. As for individual program of medical rehabilitation for patients with coronary heart disease, this program should be component and depending on functional class of the stable angina. We can use of physical activities, patient's physical activity. We should prescribe any physical activity regime with control of heart rate, blood pressure, and sustainable employment. As for other methods of medical rehabilitation, there are methods of psychological corrections for patients with coronary heart disease, educational programs, increased motivation to implementation, doctor's recommendation, and direction to the spa resorts or to the spa procedures in special limited places, such as resorts or sanatorium in very comfortable places on the sea coast and mountain regions. Criteria for the assessing of effectiveness of patients with coronary heart disease rehabilitation. As I said, half an hour before, we can achieve full or partial recovery of the patient's disability. We can achieve a reduction in the incidence of patient's complication and a reduction in cases of temporary disability due to disease progression. And of course, a reduction in the new cases of primary disability. From other criteria of effectiveness, this rehabilitation, it can be improvement in functional parameters of the cardiovascular system. For example, achievement of stable normal cardia or heart rate between 60 to 70 beats per minute, improving exercise tolerance, improving the quality of life of patient's life, which we can measure by special questionnaire. And it will maybe most reliable indicator of this program effectiveness than just subjective assessment. Now let's make 10 minutes break. And in the second half of our lecture, we will continue our program. And I will inform you about main rehabilitative program for patients with respiratory disorders with COPD. Please try to write, to record and to send to the chat the amount of your group members which are present now. Break 10 minutes, please.
Okay, sir.